Thank you, Mr. Chairman, and thank my colleagues for their courtesy. I wanted just to make sure that before I have to leave in a few minutes that I speak strongly in favor of Senator Rockefeller's amendment, and I hope it will succeed. And just in case the debate melds also as to Senator Schumer's in the alternative, as much as I hope Senator Rockefeller's will succeed, should it not, and I hope it will, then I support Senator Schumer's as well. And I want to give some context. This, in essence, is about choice. We hear a lot about choice, but there's such a demonization about this one possibility of a choice within a panoply of other choices. And it seems we're all for choice until one of the choices can be a public option. In essence, a choice of a health insurance plan separate from the private insurances that are all going to be set up in this exchange. And it is just that, a choice, not a mandate, a choice. In a nutshell, a public option, in my view, clearly increases competition, keeps insurers honest, drives down costs. Now, why? Why do we need a public option? Well, look what's happening in the health insurance industry without one. Costs are skyrocketing. My home state of New Jersey, between 2000 and 2007, we saw insurance premiums went up 71%. Reality is that's far beyond what the wages of New Jerseyans have gone up, and that's true across the country. Options are limited. You know, I hear a lot about how many insurers there are, but insurance is really driven by the local market. So let's look at what those are. And I appreciated Senator Rockefeller's questions and the answers, and I appreciate the chairman's intervention and some of what he had to say. But let's be honest, this is an industry that has $25 billion annual profits of an $800 billion annual revenues, and that doesn't include investments and other proceeds that they have. So it's true that of the $500 billion in subsidies we're going to create, some of those are going to be spent in the services of those people, but not everybody's going to demand $500 billion of services automatically, so there obviously is money that will be going to the insurance companies. And so, you know, they have participated to about 8% over the course of the decade of what their present annual profits are, and this is before they have this whole new universe of entrance into the system with significant subsidies by the federal government. And so it's hard to understand how in the midst of all of that a public option creates such a dire consequence to them. Now, I have heard already, and I'm sure we'll hear again, that the public plan is government-run insurance. To me, that's absurd, and everyone knows it. There's a reason there is such overwhelming support for a public plan. We go and talk about more and more choices, but we seem afraid of giving them the one choice that in every poll still to date, overwhelmingly, by 2/3, American people want a public option, yet we don't want to give them what they ask for in this reform. It will not be government-run insurance. It will be independent. It will be self-financed. It must be self-sustaining. That, to me, is not a government-run insurance program. No provider will be forced to participate in it. And for patients, it will simply be one more choice. No one's required to sign up for the plan. It's an option for the public. You can stick with your private insurance if you want to. And there is a fundamental difference. Yes, Medicare is a government-run program, and for those who are in it, they overwhelmingly like it, but there's a difference. It is also an entitlement. And such as an entitlement, it's an obligation that the government has automatically for all those who qualify. But this is different. We're not talking about an entitlement in a public option. We are simply talking about a self-sustaining, independent, self-financed entity, and that is fundamentally different. So it's good to talk about Medicare being a publicly run insurance provision for those who qualify because of their age and other conditions, but the bottom line is it's far different than this. This is not an entitlement and therefore a mandate.
Would Senator yield for a question?
If I can finish my presentation, then I'm happy. There's already competition, we hear. Plenty of competition in the marketplace. There's 11,000 health insurers in America. But actually, the opposite is quite true in terms of what we really want to hear about competition. Health insurance is one of the least competitive businesses in America. Opponents of the public plan like to talk about how much competition there is in the insurance market by talking about how many insurance companies exist nationwide. But health insurance markets are almost entirely local. And studies of how uncompetitive insurance markets are pretty damning. If you look at the MAA, if judged by the measure used by the Justice Department, 94% of insurance markets in the United States are now highly concentrated. And we heard the answer before to Senator Nelson's question. There are states like North Dakota where 2 companies control 92%. That's real competition. 2 companies, 92%. In Maine, 2 companies control 88%. In Montana, 2 companies control 85%. In Wyoming, 2 companies control 85%. In Iowa, 2 companies control 80%. In Idaho, 2 companies control 75%. And it can go on and on. My God, 2 companies? That's real competition. That's real competition. Now, the other thing is this idea that the government will get more involved in your medical decisions that we've already heard and probably will hear a lot more about, between the government being interposed between you and your doctor. Well, let's hear from those who we care about most in this respect, our doctors. Our doctors. What does the American Medical Association say about that? They say that because of a lack of competition, the physician's role is being, this is quote directly from the AMA, the physician's role is being systematically undermined as dominant insurers are able to impose take-it or leave-it contracts that directly affect the provision of patient care and the patient-physician relationship. So the existing system, the one that I just described, that in so many parts of the country 2 companies control 80, 90% of the marketplace, they're already telling the physicians, because they have this incredibly dominant position in the marketplace, by the way, if you don't like this, you don't have to join us, but we're covering 90% of the marketplace. So tough luck. So the present set of circumstances has private insurance companies interposing themselves between the physician and their patient. And finally, the suggestion that this is going to put insurers out of business. You know, we all know that insurance companies can compete at a lower price point, but they just don't have to right now because there's just not enough competition. This will force them to consider that lower price point. And I think that that's incredibly important. That still means that they'll make money. And we're going to have this whole new universe of people who are now going to be insured, and we're going to give big subsidies, a part of which will obviously go to profit, because not all of it's going to be consumed by that health care costs. But this is about having a standalone, self-financed insurer who, at the end of the day, can create the type of real competition you want to see in the marketplace.
Would Senator yield
That's
for a
why
question?
I support Senator Rockefeller, and if he does not succeed, Senator Schumer's